Okay, now we're live. Good morning, everyone. Welcome to the fourth conversation of a four-part series, Pilgrimage Through the Pandemic. Thank you to those who have traveled with us from the very beginning of this four-part series. And for those who are joining us for the first time, welcome and thank you. I would like to share with you that our three prior sessions are on our website. So please, if you get a chance, if you haven't been following us all along, go out there, check them out. There are reflection guides that accompany each one. Share them. Go through them yourself. Share them with a small group, your church, friends, gatherings. Just share them. And we thank you for that. We have heard many voices over the past 4 weeks. And the stories that they bring. And it has been our overarching question in this series as to how does your story, God's story, and the story of this city intersect. With that said, I would like to introduce my partner in crime this morning, Joyce Spate. Who is the CEO and founder of Virtue Events. She's also a board member with DurhamCares. She serves as a board member with DurhamCares as well. Joy will be asking questions, and she's the business guru. So she will be helping me out this morning, and I appreciate her for always coming to my aid. We have some wonderful panelists, like always, this morning. Our panelists are, and I'll let each panelist tell more about who they are, but I just want to give you where they're coming from this morning. We have Jory Bryant, who is with an organization called Symbodied, I believe, and SIP, and he'll explain that to you, as well as on the staff of DurhamCares. We have Reverend Russell Pierce, who is the executive director of Housing for New Hope. We have Drew Dahl, who works with the Coalition for Nonviolent Durham. We have Amber Lynn Harper, and we have Ashley Harper. Amber is, I don't want to mess up her business name, so I'll let her tell you what that is. It just left my mind. And please forgive me, Amber. And Ashley Harper, Harper's Parlor, both small business owners, and grew up, raised in Durham, and grew up and have brought their talents and gifts back to the city in the form of a small business. So with that said, I'm going to now ask Jory if he will share with us what he does and how COVID-19 has impacted the work that he does. So Jory.
Yeah.
Thank you.
My name is Jory Bryant. I have a couple of hats I wear. One, church mobilization officer for DurhamCares. I have a food consulting business called Symbodied, and I am currently acting food director for CIP, Communities in Partnership. And I started prior to COVID-19 with CIP, working with the co-op that's been running for about 3 years now. And its primary objective was to get fresh foods to people in the East Durham community, most of them Black and brown folks who are experiencing all different types of life issues, and taking care of those who are the original people of East Durham prior to a lot of the change in housing and gentrification, for lack of a better term, in that community. during COVID-19, since COVID-19 started, we pretty much had to ramp everything up, and it immediately took off. And a lot of the programming that we were currently working on just became more of a necessity. And so we began feeding people instead of running our co-op for once a month. We started doing it for every other week. We would have done it every week, but due to the nature of COVID, we wanted to give people a time if they were infected to actually display some sort of symptom. And so we have to use COVID practices in the way that we distribute food. And so since coming on and taking over, we transitioned to now, we were working with a nonprofit getting most of our produce initially. Originally, now we're getting almost 95% from African-American farmers across the state. And we're feeding almost 600 people every 2 weeks. And that's give or take 50 or so. My phone is blowing up, so I apologize. And so my work with Somebody directly played into that because I was already connecting food businesses with Black and brown farmers. And because I've had a bit of being in both fields of farming and being a chef for so many years, it'll just allow me to see both sides of it. And so I dedicated my time to doing that work. And so this has kind of just opened up the floodgates because our food system was already broken. It's been broken since the conception of this country. Our food system was built on slavery. And so my primary objective is to liberate many Black and brown people because everybody has to eat. Everybody does not, we don't have an option on that. And where your food comes from is normally supposed to be a choice. But when you're experiencing poverty or experiencing incarceration or experiencing many different other issues, you oftentimes don't get a choice in that. And there's a term called a food apartheid that organizations like CIP are attempting to address and are addressing. And that's normally just kind of, they used to call them food deserts, but a desert is a naturally occurring thing. And a food apartheid is something that's purposely done. So we use that language instead. So we're trying to address that when communities who have essentially been cut off from their primary food sources, the best you might get is fast food in their community, but they really normally don't have a grocery store walking distance. And so because of that, you have to think creatively on how are you going to get food to those individuals. And that's kind of my primary job right now. And with DurhamCares, we're actually trying to figure out how do we help the churches become a part of feeding individuals through this process. And so we're also working with In Hunger Durham as well on feeding seniors. And one of the catering companies that I consult with has taken on a large portion of feeding those seniors. And the demand is constantly increasing. And we're trying to figure out how do we feed seniors who are not in public housing, because the ones that are in public housing are being covered. And we've already started through the co-op feeding a number of seniors, and we're trying to expand that out for the rest of the city.
Hey, Jory, it's Joy. Hi. So I had a few questions as you were doing your introduction. One, do you foresee that there will be some food shortages due to COVID?
I mean, yeah, we've already seen food processing plants shutting down, many other issues happening. I think that America is actually, when it comes to food, America is a very interesting place. A lot of us think that America is at risk for a lack of food, but America actually exports more food than it actually imports. And the issue comes in is like, we don't, as a country, is so based on capitalism that many of you might have saw farmers pouring out milk or breaking eggs or things of that nature, when you have communities who lack resources, but at the same time you're willing to waste food. Well, that's because we think completely, our food system, we think completely through a capitalistic lens. And because we think of it completely through a capitalistic lens, we don't understand how the system itself is pretty much created like, I don't want to say a caste system, but it has to find somebody to oppress in order for it to exist. And so oftentimes that's Black and brown people, whether it's in our prison system, where we have farms that are actually like stationed on prison campuses to feed the entire bodies of prisons within the state, or whether and our school system as well. A lot of times our prison systems are actually growing food for our school systems too, as well as just needing migrant workers on your farm in order to not get them a living wage, right? You need someone that you can oppress in order to feed people, and that's our system, and that's how it runs.
So I have to piggyback on that. So I've seen a lot of farmers pivoting, but I just wanted to get your take on that. How do you see COVID impacting Black farmers? Is it better? Is it worse? Because an example would be, I think it's a tall food box or tall grass.
Tall grass.
They have like done a subscription service, which I think is genius. And they've started to pivot. Do you see that other farmers have started to pivot? And I know that some of our farmers are elders, right? So they might not know how to pivot. Have you seen anything like that happen?
Yeah. So there's an organization that I work with called RAFI, which is the Rural Advancement Foundation International, and they and I are working together on how do we get resources to farmers, especially Black and brown. So they have a people of color network for farmers, and we've already kind of identified many of the organizations that are working with Black farmers, like Tallgrass and many of those organizations. And we have been able to, in some ways, try to help farmers get resources to interact with those organizations better, or do that on their own. And so some farmers make that transition very quickly, and some of them are resistant. But I think that what COVID has done is exposed a lot of the cracks in a lot of our systems. And so COVID actually has showed people like this. It's not that a lot of that pivoting that you're talking about wasn't a possibility before COVID-19, but people didn't see the need for it. And now that this has happened, in some ways, I think we might have like a cultural language now of like, we're not going back to before this. Mm-hmm. In many ways, we're not going to digress back to not having an online market or not being able to get a farmer in direct contact with their customer base. And so we're working on how do we help farmers do that. My experience as a chef is kind of helping them to say, okay, this is what chefs need from you. This is what caterers need from you. And this is what restaurants need from you. And there's other infrastructure as far as grocery stores and other things that we work on to kind of help them build that on their own. And so they can choose if I want to deal with a Tallgrass or some other organizations, or do I just want to do this myself?
Thank you for sharing that. You're on mute, Tammy.
All right, thank you. We're going to move on now, and we'll come back around if there are questions that come up. And let's hear from Russell about Housing for New Hope. How has this affected you and the work that you do?
Sure. Well, a little background may be helpful for those who aren't as familiar with Housing for New Hope. So we've been active and engaged in Durham for nearly 30 years, and around homeless services and affordable housing. And the way I explain it sometimes, that's maybe easiest, folks are pretty familiar with what an emergency shelter does. And a lot of folks are pretty familiar with what like habitat houses are meant to do in a person's life. And those are kind of two parts of the spectrum of that journey towards sustainability for an individual or a family. For us, we don't have a shelter. We don't do habitat houses, but we're in many ways a connector and partner throughout the rest of that process and that journey. So we operate the city and county's primary street outreach programs. So connecting with folks that are in encampments or experiencing homelessness and are quite literally unsheltered. If folks are moving out of the shelter or moving from the street or encampments to housing, oftentimes we're that partner through rapid rehousing. We have two communities, about 44 units for folks who have had long-term housing in a disabling condition. And then we partner with the city on another 30 units across the city in market rate for folks who've had that same long-term experience. And then we have a couple of our own workforce housing complexes, including, we're proud to say, the award-winning Holloway Place that is the city's community's first experiment with affordable co-housing for women who are single and who have an income a little under $30,000 a year. So we're at several places in that continuum. I think the pieces that have most affected us, because we do work in partnership and part of a larger system, obviously COVID has a major impact on emergency shelters. Most people may know that Urban Ministries, which is our primary shelter here for folks who are single, and there's some space there also for families in addition to once a family's moving forward. They were moved actually out to the Marriott at the RTP because it was deemed to be safer to have folks able to be in a hotel and sort of shelter in place in that way. And one of the pieces we've continued to work on even before that move happened was through our rapid rehousing and other housing programs is to much more quickly than normal move folks into housing. So where we might normally move 5 to 8 households in a month, we're moving 20 households in a month at this point, and trying to work really hard now with, the Marriott is not a permanent solution. We know that Urban Ministries will have to reduce capacity in order to keep safe social distancing. And so we're looking right now in partnership with them to figure out really what reduced capacity means. Is that 40%? Is that 50%? We know families moving forward, the family shelter, they're going to drop to 80% capacity in order to operate safely. And so what that means is that we're working with a lot of partners to figure out how can we more rapidly move additional folks out. We could be looking at trying to move more than 50 households, we being a partnership of many of us, when the hotel closes, which is currently anticipated at the end of June or in early July. So a lot of what we do ends up being in partnership, and one of our big pieces right now, working very closely with Community Empowerment Fund, the veteran homelessness programs, to identify more housing, because our big issue, this always comes up, is how do you find additional affordable housing? So we've partnered with some state and national organizations to bring additional funds to bear so that we can quite literally unlock doors. So last week, a team that might normally open up a couple in a week opened up 15 doors. So now it's just a matter of getting folks matched to those housing options. So what we're largely seeing is this big push because shelters are not an appropriate option beyond a certain number. And so how do we continue that push to get folks into housing just as quickly as we possibly can?
Hey, Russell, it's
Hey.
Joy again.
Yeah.
So quick question. I have two primary questions for you.
Mm-hmm.
One, I heard you kind of say that you were partnering, or Housing for New Hope was partnering with the city. In a perfect world, what would it look like if the city made this a priority for Housing for New Hope? And I know I'm putting you on the spot, but I'm I'm trying to conceptualize, because this is a huge problem, right?
It
And
is. It
so
is.
it's like eating the whole elephant at one time versus chunk by chunk or bite by bite, right?
Mm-hmm.
So in a perfect world, if we could actually really affect the homelessness situation or the affordable housing situation in Durham, in our city, and the city made that a priority, what would that look like? What would that take? And I guess part of that would be connected to what Housing for New Hope's mission is. Am I
Certainly.
correct in that assumption?
Yes, and I would say, you know, what we've experienced, and I'm gonna go back even a year. So I came back to Durham after 18 years away. Came back to North Carolina after not quite 18 years away,
Mhm.
and we'll say I was shocked by the cost of housing in Durham versus when I left seminary back in 2001.
Right.
It was very shocking, and I think that the affordable housing bond has some real potential. Um, if there are ways to fast track some of that. And I think right now we're going to have to be looking at that. I mean, I know there are a number of us that are, I was just actually on a call a little bit ago with another leader in town who was saying, you know, what do you need to fast track? And I said, well, I can identify resources to procure land. In some cases, I already have land that I could grab if I wanted to. And there's resources to do building. We just need resources to have staffing that can like project manage or develop that kind of piece.
Okay.
But there are efforts and conversations around that. I will also say that a couple of us have been convening a group each week that's, for lack of a better term, it's community leaders working around homelessness. And every week, the leadership from the city's homeless services program and the county manager's office are represented in those conversations. And that's helping make connections across a lot of organizations from the housing side to the medical side. Duke has representation, Central has representation. I mean, it's a pretty broad group that really came together on its own in order to work on that some with the city. I think the other piece I'd say I'll say two, then I'll button up. But there's been a significant increase in funding over the last few years around all aspects of homeless services. I think it's maybe gone unrecognized at moments, but it's been interesting with the development of Entry Point Durham, which is the coordinated entry system. That's giving one place for folks to go and get support and connections. And that's making a difference, not only in making it easier, but it's also enabling folks to, well, it makes it easier, but we're also able to get better data. So we know now, which we didn't know a year ago, that there are a lot more folks who are single and homeless than there are families that are homeless. A lot of our concentration has been around families, and that's very understandable because of the children involved. But you know, it's more like a 75-25 or 80-20
Wow.
split when it comes to that. I think the last piece I'll say is a number of us are starting to think through with this new city county, this recovery committee. I don't have the exact name in my head that was announced by the mayor and the chair of the county commission. It's very focused on the economic piece and has lots of subgroups to it. And I think we're starting to ask questions about how do we ensure that folks who are experiencing homelessness or are on the very edge of it, and we know that's going to be an increasing number of folks here. How do we make sure that's a part of that conversation also?
Wow. Thank you for sharing that. It looks like we have a question from one of our viewers, Robin. Thanks, Robin, for submitting a question. It says, what measures are being taken to address the underlying issues of homelessness, to provide people comprehensive services to address holistically the needs of the homeless population? So I'm assuming, Robin, and feel free to add in the chat, that you're referring to like job creation, any type of like mental health services, all of the things that can help our citizens become more productive.
Mhm.
And yep, she said also mental health. I
Yep.
got you, Robin.
So
Okay.
it's interesting because that group I mentioned that meets regularly, Alliance is at the table, and like I said, Duke's at the table, Lincoln Community Health is at the table, and even with the setup at the Marriott at RTP where UMD is now located, they have set up telehealth options within the hotel in order to make sure those connections are much easier to make. But all the time, I would say, I know like our street outreach program originally grew out of work with Alliance directly. It was funded by Alliance back in the day. So that's always a part of it, because we know that folks who are experiencing homelessness, there's often a mixture of challenges around mental health, challenges around substance use, and a variety of pieces. It's very complex. And there is also work with NC Works and efforts, particularly on UMD's urban ministry side, to continue to develop employment partnerships. So that is something that's always on the plate in front of us. Yeah, great question.
Yeah, I think Drew, which is a good transition, he'll be coming up and he'll be able to share that. But I want to bring Ashley on before we start with Drew, and let her share as a new business owner. And then here comes Rona. So Ashley, if you would like to share with us at this time.
Oh my gosh. Oh my gosh. So I've been a nail tech. Hey y'all, I'm Ashley Harper. I have Harper's Parlor Nail Salon in Phoenix Square. I've been a nail technician for 7 years. I just moved back to Durham 2 years ago, and I opened up a brick and mortar 7 months ago. Wow, what a heck of a time to open up a business. Honestly, I've been nervous, but I haven't really experienced what you guys, on the level that you guys work with. I was nervous in the beginning. I didn't know how this was going to go, how rent was going to get paid, utilities for the shop. I just didn't know what was going to happen. Once everything got settled with unemployment and the SBA loans and things of that nature, I haven't really honestly felt the impact. Yes, I've been out of work for 2 months, but in my field, people are ready to feel better. So I don't think I'll be out of work for too long. Honestly, this has been a good time for me. It's been bad because, I can't go to work. I can't bring in my regular income. But I've been resting. I've been praying more. Self-care has been an ultimate high. I really cannot complain. I really can't. I'm worried about when I do go back to work, how to keep everyone safe, where to buy my products from, because as of right now, people are nervous, about getting products from overseas. I'm not nervous, but people are. And that's about it. Honestly, it's just one of me in the shop right now, so I don't have to worry. I don't have to worry. I'm not worried about anything right now. Life is good.
Hey, it's me again.
Hey.
All right, so a few questions. One, most businesses in this time have been trying to figure out how to pivot, right? So how to go to a virtual landscape or things like that. Have you given any consideration to how Harper's Parlor can pivot and do things virtually, like perhaps classes or courses is one, specifically around the amazing designs that you do. And then two, I heard you say something about your supply chain, right? And so some of your products come from overseas. Are there any minority owned or?
Yes, absolutely. They are popping up out of everywhere, and I can't wait to support. That is definitely going to be my main source of supplies now. I don't have a choice, but going virtual, that's not my reality. I don't know how to pivot into that world. I'm sure I can do classes and things of that nature, but I don't want that to be my main focus. I'm on nail health. I'm physically touching you. I have to. I'm sure I've been looking into doing press-ons.
Okay.
So that's my pivot. That's what I can do. That's what I can offer. But other than that, I don't know what to do.
Yeah. Yeah. Well, it sounds like you're actually spending the time, as am I, because I'm in the people business, right? So my entire business model is bringing people together. Go figure, COVID, right? So now that COVID has happened, I have to think strategically about how to keep people apart. And then once the world opens up, there is going to be a lag in people feeling safe, right? So, you know, there are things that are going to be essential to my business now with bringing people back together that are going to impact my costs, right? So like masks for everybody on my staff.
Which are out of hand. The expenses for masks are out of hand.
Yeah, yeah, hand sanitizer. I mean, toilet paper, for God's sake. So, you know, these are things that I think on the front end will impact, it'll make people feel safer, but the cost to the business owner is going to be absorbent, right? So,
yes.
Do you feel the same?
I do feel the same, honestly. I'm one of those people that I have to be in it to feel it, and I haven't felt it yet, so I don't really have a good answer, but I don't know what to do.
Yeah.
So
I have one more suggestion, and then it looks like Robin, you are on it today, is asking another question. She said, "Great attitude, Ashley, love it. Can we have Ashley's business name and location in the chat?" And I will tell you that, but I'll also put it in the chat. It's Harper's Parlor, and it is over in Phoenix Square, right? And so one thing, Robin and Ashley, that I've noticed a lot of businesses, particularly restaurants, have been doing, and that is gift certificates, right? So Robin, that is one way that you can help support Ashley, and I'll put her information in the chat. But like purchasing gift cards and gift certificates for all of our service providers is a huge way to support them during this time, right? And so that when the world opens up, you can actually patronize them. So I just wanted to throw that out there, and I'll do that as well.
Thank you.
Absolutely.
Thank you, Ashley. And we'll come back if there are other questions from participants. We'll try. I want to hear everybody's voice before we get into some major questions. Okay, Drew. Thank you for being here. Would you like to share with us what you do and how you have been impacted, your hopes, and all those things you're sad about? Share with us.
Hey, so I'm Drew. I work with the Religious Coalition for Nonviolent Durham, and I'm also on the strategy team for DurhamCares. Coalition has been around for, 25, 26 years now, and focuses on trying to rectify the impact of violence in Durham. The Reconciliation and Reentry Ministry, which is the piece I do, has been around for about 17 years now. And what we do, normally, what we do is we put teams of community volunteers, generally 3 to 5 volunteers in a team, with one person coming home from prison. And our focus is on, we say we have 2 imperatives, endless belonging and boundless compassion. Everybody belongs. No one has sinned so greatly that they're outside the grace of God or outside the reach of community. And so we just try to build bonds of friendship. We are in partnership with Durham County Criminal Justice Resource Center, which has worked well over the years. They have traditionally done the heavy lifting of paying for stuff and providing classes and services, and that leaves us free to focus on being friends and building relationships. And that's really true of the coalition. We are a relationship-based organization. We're not really a service provider. Everything we do is about building connections between people. So when you think about the slow work of God, that's what we're involved in. So that was the before time. Now we are in the pandemic. And back in early March, DurhamCares wrote a letter to the DA talking about the enormous risk that people in the Durham County Jail and in prison were at risk from COVID-19. And we asked her both to try to reduce the jail population and, where possible, to let people go ahead and come home from prison. So fortunately, the DA was already kind of thinking that way, and she had already done a lot of work. When she came in January of last year, the daily jail population was running in the mid to high 500s. It had gotten down to around 360 a day by late February, but due to some initiatives she pushed through, that's now running about 260 a day. And generally what we're seeing is, unless there is injury to another person where you want to detain somebody, most people who are arrested see the magistrate the same day and are back out again on either no bond or unsecured bond. So the DA's office deserves a lot of praise for working to keep the jail population down. Also, she was willing to consider working to release people who were older, had health issues, had essentially nonviolent crimes, and had served the majority of their sentence. North Carolina Justice Center made this request statewide. She is the only DA in the state to actively pursue that initiative. Has taken a lot of flack over it, and she deserves our support and respect for being willing to take that stand. We had an initial list of about 25. We got 14 of those home and 14 of those released in pretty quick order. 3 were under either federal or ICE detainers, so they weren't able to come back to Durham. And then they kind of pivoted and are working on people that still don't have human victims, but might have a breaking and entering or property damage. The vast majority of people coming home have significant health issues. And a third are homeless. So this is where COVID-19 has dramatically impacted us. In the normal course of business, when someone comes home, they've had several months of developing a home plan. And so we kind of know what's going to happen, and we have some warning. With the early release guys, that's not the case at all, because there's some guys being released 2 years early. They hadn't even thought of a home plan. So there's a lack of planning. And with the impact of COVID, Department of Public Safety has almost completely stopped giving us information about the condition and the home plans of people who are normally scheduled for release. So from the reentry side in Durham, we're really operating a lot in the dark. We also have prisons who, for one reason or another, are not providing transportation back to Durham. So we've had a couple of cases where, we've gotten a call at 2 in the afternoon from a prison, Wake Correctional was the last one, saying, yeah, we forgot to get this person a bus ticket, and today's their day of release, and we don't have anybody who can bring them to Durham, so we're just going to discharge them here at the gate. If you want them, come get them. Now, fortunately, we've been able to go get them, but we've had one case where we've never found the guy. He was just pushed out the gate, and that's a month and a half ago now. We still have no idea where he is. So we're working some in the dark, and cities shut down, counties shut down. A lot of the nonprofits that we normally partner with are shut down. Clothes closets by this point are really drained. So the impact on us has been myself, Chuck Manning of Welcome Home, if you're familiar with his nonprofit. They work with, they provide resources and peer support the first 30 or 45 days home. So they're kind of the front end into Durham reentry. And Demetrius Lynn, who with the CJRC shut down, he's a local reentry coordinator, but he still is able to kind of give us some guidance on services. The three of us are really working together in the absence of any official support, and with some very generous support from North Carolina Justice Center. We are arranging to house guys as they come home. So there are several issues there. Some guys are coming home from Noose. And if you've been watching the news, Noose Correctional Center is one of the worst prison outbreaks in the country. So we have guys coming home from Noose or other places with outbreaks. Well, they have to isolate, and we are isolating them for 14 days in a hotel. But that carries some requirements to it because we don't have enough of them to take a whole hotel. So we book a hotel. We have to get them clothes. Well, clothes closets either aren't open or the ones that have been don't have anything. So it's go to Rose's and buy them kind of a starter set of clothes. We have to get food into them, so somebody's got to shop for them. And then we're trying to do meal trains, so they have at least one hot meal a day. And then the normal kind of peer support stuff is really complicated because they're coming from a place where they've been exposed. We have the last guy we had came home knows he is positive. So when you're meeting with them or doing peer support, they're having to mask and glove up. You're having to mask and glove up. You really don't want to do that in the room. But there's stuff you talk about in peer support you don't necessarily want to talk about on the balcony of a hotel. So there's a lot of complications around that. For guys who are being released homeless that are not from a site that has a COVID outbreak, we're utilizing Jubilee Home. Dave Crispel's organization, and that has capacity for 3 guys at a time, and there they have meals provided, and it's a little easier to do peer support there. For guys who are coming home who have family or friends that will take them in, well, that's great. We offer them isolation. So far, only one guy's taken us up on it, but many of those guys coming home made those plans or had that anticipation in a world where people had jobs. Many of them coming home are now coming home to households where either hours are dramatically reduced or they're out of work altogether. So one of the things we're doing is providing gift cards for food, for grocery stores to try to help lessen that impact, along with clothes and all that other kind of stuff. So, our first priority is getting people housed safely. That's the first question, is where are you housed safely, and are you getting adequate medical care? The FIT program, Formerly Incarcerated Transition, is a program that exclusively focuses on medical care. Their caseload has gone from pretty full to insane because pretty much everybody coming home on early release has significant medical issues. And normally, hey, we just run into Lincoln. Well, that's tough to do now because there are requirements in place. For guys who come home and say, hey, look, I've got to go to work. Well, the prison system, for some reason, has started taking prison IDs when people come out. So we have guys coming home with no Social Security card and no ID. What do you need to get a Social Security card? Well, you need a birth certificate. Up until the last week or so, it has been impossible to get a birth certificate. Now you can get a birth certificate, but the Social Security office is closed for any kind of personal contact. So their reaction, they say, call on the phone. If you have tried to call Social Security during a normal time, it's almost impossible to get through. You cannot get through to Social Security. So you can't get a Social Security card. Without a Social Security card, you can't go to DMV, but you also have to make an appointment now. You can't walk into DMV. They do it by appointment. And you have to call the phone number, and nobody answers the phone number. So even if you come home and you had a job, having the documentation to get to work is extraordinarily difficult. And even if you have that, the buses are running on Sunday schedule, which means they only run every hour. They're limited to 16 people on a bus. So we have a guy who got hired and he can't get to and from work because he lives about midway on the route. So whether coming or going, there are already 16 people on the bus when it gets to him, and they just pass him right by. So coming home from prison, finding housing, getting a job, reacclimating to Durham is tough enough in normal times. COVID and even, and understand, Durham is the best place in North Carolina to come home from prison. That's true normally. It is especially true now. We have about the only functioning reentry in North Carolina right now. But even at that, it is a severe burden on people coming home to be able to get housed, to get fed, to get clothed, and to be able to do something that has some sense of purpose to it.
Well, Drew, as you can see from my expression, with all that's going on, thank you for the work that you're doing. And it's a lot. So I guess my question would be how can we help? How can we put out here on this platform how people can help and assist? I know it's a lot of things we can't do.
Right.
In what ways can we assist you?
So we are using Jubilee Home as kind of a, Dave probably won't appreciate this, but we're using it as a drop-off spot for a lot of stuff because they do have some storage space. So if you're interested, we desperately need welcome home boxes, and that is a box of both kind of toiletries, personal supplies, and some packaged food. Everybody that comes home gets a welcome home box. It gives them about a month of toiletries, about a week of packaged stuff. Now, we completely understand you will not find hand sanitizer, alcohol, or peroxide, more likely than not. That's fine to leave out, but the food and the toiletries are critical need items. And I'll stick my email in the chat. If you want the list, please email me. I'm glad to send you the list, and those can be dropped off at Jubilee Home. That's a huge need because guys are isolating. So they can't go, even if they had money, they can't go out to the store to buy stuff. And y'all know, you've been in the grocery stores, you know how hard, I was there yesterday, there was one dishwashing liquid in the entire store. It's like, why are we stockpiling dishwashing liquid? But anyway, you don't have the ability if, to go back tomorrow to go to another store. They do not. So that is a huge help to us. If you can do welcome home boxes. And then in anticipation of us opening up again, at whatever point the county opens up, and like Rescue Mission Urban Ministries, those clothes closets start opening up, there is going to be a huge need for clothes. So go through your closets, bag stuff up, and as soon as we can start taking it, please drop it off, because we are in desperate need of clothes. I'm going to Rose's, and honestly, thank God for Rose's, because I can get a week's worth of clothes for half what I can get it at Target at Walmart. So, but we're desperately going to need clothes.
Okay. All right. Thank you. Let's go to Amber, and Joy has a question. So we'll come back to Drew. So that'll, at least we've heard everybody's voice. Okay. And we'll come back around and see if there are any further questions. Thank you, Joy. Amber.
Hey, y'all.
Yeah.
I am a makeup artist. The name of my business is Amberlyn Beauty. I work mostly with bridal. So right now that is an industry up in the air because we don't know what large events are going to look like moving forward. I've been doing bridal makeup professional makeup for about full-time for 4 years now. I started out in retail and transitioned over to full-time. During COVID, it's been a little stressful, and I think it's more so not the loss of income, but the people management has been real. I have clients who are having canceled events, whether it's bridal, branding photo sessions, all type of events being canceled. So I've been having to keep calm. I limit my emails to twice a week because there's nothing urgent right now. And yeah, I'm just talking to people, trying to see when we can reschedule. It's definitely had me really zoom in on my contract and what that looks like. And having a COVID clause in there to move forward with clients. Also looking at what taking clients coming up in the next few weeks is going to be like. You know, doing waivers has been a crucial step. I think that's going to save me and a lot of other people who have personal care services, where we have to touch our clients. I know Joy was talking about how to pivot online, and offer more virtual services. So something I have done is online makeup sessions. And I plan on doing an online makeup class, but haven't set a date yet because that's work. And I've been enjoying sitting on my behind. um, yeah, so that's pretty much all I have going on. You know, keeping the peace at home, keeping a healthy mind, and somewhat of a normal routine.
Yay. Okay. So for everybody on this call, Ashley and Amber are like two of my favorite individuals in the world. So I'm just so happy to see them. I haven't seen you in like 2 months. So I'm just like, I want to grab you. So yeah, you were one of the people that I like, as soon as I found out what was going down, I texted you and was like, look, get it together, and tighten up, because we're in this for the long haul. One thing that I have noticed that is resurfacing, is the idea of micro weddings, which people are starting to do, which is, for those of you that are on the call, a micro wedding is pretty much just a handful of people, and you're pretty much going through the show of the wedding, but without the crowds. So one thing I thought about, as I was talking to one of my business partners yesterday, now that we have 2 venues that we were launching right before COVID, and now it's COVID. So we were talking about doing micro weddings. And the first thing that I thought of is like, well, if you do a micro wedding, could you get makeup? And
Absolutely.
yeah, I think some people are ready to work, because this is our busy season right now, right? So like we're usually busting at the seams at this moment. And
yeah,
now we're about to head into June, and the initial thought by the CDC and the World Health Organization is that COVID would slow down during the summer months, because it's hot, and then it would ramp up in the fall. So now it's 45 degrees outside in May. And so I think part of like thinking through how long this is going to last, we really have to depend on the scientific data, which they don't have a lot of, 1, and then 2, just common sense on how to take care of ourselves and our bodies, right? And you and I both know, like, our interaction when I go get my makeup done, like, I'm all in your personal space, right? So thinking through like what that is, how that's going to change in your process, and in how long it takes you to service a client, is going to be like so critical. But I am happy that you're doing, I don't know if you saw my round of applause for your classes. I'm really happy about that. I need to tell my daughter. So yeah, it's a lot, but I will keep you posted on the micro weddings once we launch it.
I've been having a lot of those pop up.
Have you?
A lot of my clients are like, we're going to stick to our date. I've had another coordinator contact me where she's building that into one of her offers on her site, so people could choose that. And the biggest thing is people want to feel good, feel beautiful, look beautiful. They're going to have those pictures as keepsakes. So people are still definitely interested in getting their makeup done. Surprisingly, our phones have been hot boxes. And I'm like, y'all, did you see what's going on? Like, are you looking outside? No, we're not taking nobody. No, you can't come to the house. No.
Yeah. Huh. That's actually a good thought though. But because I think, and this is going between you and Ashley, aren't nail salons scheduled to open up in phase 2, which I think starts tomorrow?
Oh my God, yes. I'm not ready. I'm just not. I thought I was. I thought I was ready to work, but I'm not.
Yeah. Okay. I just thought I wanted to make sure, but yeah. Okay. Tammy, I'm gonna turn it over to you because I can talk to these two all day.
Yeah. Thank you. Thank you so much. Our time is running, and I think, yeah, it's getting to the end. Joy, you did have a question for Drew, I think.
I did, but I think he, I did. Oh, well, it's 2-part questions. One, I wasn't sure if I heard you correctly. Have they suspended ice raids?
That's important.
So I do that. Oh, there we go. I don't know if they suspended raids. They have not suspended detainers. If there's an existing ICE detainer, and in the cases where people had federal detainers and ICE detainers, the attorneys at the North Carolina Justice Center asked them if they wanted us still to pursue early release, and in all 3 cases they said yes. They wanted to go ahead, and because North Carolina state prisons are so dangerous, they said they felt like anywhere was better than where they were.
Okay. And then the second question is, how can the city, may have answered that with the welcome home packages, but how can the city support you all in a meaningful way as they're transitioning back into?
Yeah, so the city, Welcome Home came out of the city and has actually, at least through the end of this fiscal year, housed there. Steve Schewel has been a huge supporter of reentry and Welcome Home and all that. It's the problem right now is with all city buildings and all county buildings essentially closed. They're just not able to help at this point. Until they open up again, there's not a whole lot they can do.
Okay. All right. Thank you so much for sharing that.
Well, everyone, we have come to the close of our session. I know we just touched the tip of the iceberg. We could probably go on for a couple of hours at least talking about this, but hopefully for our participants, it at least gave you an idea of what's going on. That was part of what we wanted to assure in this pilgrimage, that we hear local voices, because we hear the national voices and we hear the statewide, but to put, to hear from people that we run into, that we see in this city, because Durham being a city is still a small city. And so we have circles that we kind of see people on a regular basis. So it's good to hear those voices and to hear the concerns. It's been a good series. I thank you all for being the final panelists for this 4-part series. And thank you for all that you do in the community. Keep on doing, keep on holding on, and keep on trusting God in the midst of it, because God never fails. Amen.
Amen.
All right, with that said, you all be blessed. Go in the peace and love of Jesus Christ. And if you're interested in supporting for further conversations, hey, there's a donation button on the DurhamCares website. Click it, and we'll be happy to go into some deeper dives of some of these conversations. Bless you. Thank you.
Thank you.